Today marks the deadline for the public comments on the Department of Health and Human Services' new rule change to HIPAA. What it could do is give patients new rights to an access report so that they know exactly who's looking at their medical records.
Yeah, a lot of people want to know. Tanya Forsythe joins us from the Info Law Group with details on what could be ahead. And again, Tanya, you would think, hey, I want to know who's looking at my medical records.
Right. There's certainly that curiosity element, and I think a lot of patients are, especially these days with the use of technology, curious about who is looking at their medical records. We also hear lots of stories about celebrities who have had bad situations. But there's a counterbalance to be struck here because the law already requires hospitals and doctors' offices to provide notice to patients if someone who's not supposed to see their records does get access to their records. That's built into the law already. So now this would add additional access reporting requirements that could be quite burdensome for some medical practices, and there are some questions as to whether it might take away from attention to patient care. So that is a concern.
So you're thinking then the healthcare providers are seeing this as overkill?
There is a sense that this may be unnecessary because it may not really provide a huge benefit to patients. You know, there are people day in and day out within a medical organization that get access to someone's records because they need to in order to treat the patient. So nurses, other personnel, doctors, of course, in a hospital, other administrators who have a need to know. We often talk about a need to know in this world. And if they have a need to know, then it would not be surprising to see an access report where those people, you know, maybe every day on a regular basis see that kind of information. And the question is whether the patient really gets anything from kind of seeing that very bland report, which nonetheless might cost a lot of time and money to create.
Tanya Forsythe, thanks so much for giving us a heads up. Again, today is the deadline for public comment on that. We'll see how that fares.
Meanwhile, Maria, we have full access to